Hey, hi everyone, and thank you for joining us today. My name is Jibran, and I serve as an editorial member at the Journal of Immunotherapy and Precision Oncology, or JIPO. It's truly an honor to have the opportunity to introduce Dr. Karen Autio today. Dr. Autio is a distinguished genitourinary oncologist and early drug development specialist at Memorial Sloan Kettering Cancer Center in New York. She brings extensive expertise in prostate cancer and new investigational agents, including immunotherapy. Um, and so additionally, Dr. Autio also serves as an esteemed editorial board member at JIPO. Dr. Autio and her co-authors recently published or contributed to an article to JIPO at the end of last year, which was titled Evaluating Immune-Related Events Using PRO-CTCAE in a phase 2 study of Ipilimumab for hormone-sensitive prostate cancer. Dr. Autio, we truly appreciate your presence here today.
Thank you so much for the kind introduction. I appreciate the opportunity.
Thank you. So to start, could you please provide an overview of the clinical trial design?
Absolutely. So this was a phase 2 open label clinical trial for patients with hormone-sensitive prostate cancer, where all patients received 8 months of androgen deprivation therapy in addition to up to 4 doses of Ipilimumab. There were essentially 2 different cohorts of patients on this trial. The first cohort of patients all had de novo metastatic prostate cancer with metastases to lymph node or bone at the time of their initial diagnosis. And there was a second cohort of patients who all had biochemically recurrent prostate cancer. So they were all patients who had undergone a radical prostatectomy, may have also had salvage radiation therapy with hormones, and despite those interventions, their PSA was still increasing or rising with no evidence of metastatic disease on scans. For the patients in the first cohort with de novo metastatic prostate cancer, as part of this sort of multimodality clinical trial, those patients also underwent a radical prostatectomy 3 weeks after their first dose of Ipilimumab. As part of the trial, we were very interested in utilizing the PRO-CTCAE to look at immune-related adverse events from the patient's perspective. So patients completed a focused PRO-CTCAE survey with each Ipilimumab dose, as well as during their follow-up period. And clinicians, of course, were monitoring toxicities using the CTCAE at similar time points.
Yeah, thank you for that information. And can you briefly discuss the methods that were employed in this study?
Sure. So this manuscript, again, it focused on the PRO-CTCAE component. And just by way of background, the PRO-CTCAE was a tool that was developed at the NCI to allow for sort of direct patient reporting of toxicities. So as we know in clinical trials, typically toxicity reporting is all via sort of the clinician lens. So a patient tells us about their symptoms, we then interpret that symptom, and then we assign a grade to it. The PRO-CTCAE is more of a complementary tool that would allow patients to sort of directly report their symptoms.
Thank you.
The PRO-CTCAE survey in general, it captures about 78 different symptoms. But the sort of beauty of it is that as an investigator, you can really tailor the questions to the ones that are of most interest to you. So for us, we were interested in immunotherapy toxicities. So we designed sort of a 12-question survey focused on immune-related toxicities that we were most interested in, that included things like rash and pruritus and abdominal pain, diarrhea, fatigue.
Mm-hmm.
So that was sort of a little bit of the background when it came time to, analyzing the data once the study was complete. And we had all the results sort of tabulated. We used previously reported mapping to convert the PRO-CTCAE into a 0 to 4 scale. And then we matched the PRO-CTCAEs with the clinician CTCAEs. We reported on all grade AEs and high grade AEs. And then we also wanted to look at agreement between patients and clinicians, and we used kappa coefficients for that. We calculated the kappas based off of really just the presence or the absence of each symptom derived from the PRO-CTCAE and CTCAE, sort of pooled within all patients and at all time points.
Thank you. So I guess let's delve deeper into the results section. So could you please share the findings from your trial and how the subjective assessment by patients were correlated with the CTCAE?
Absolutely. So we analyzed data across 16 patients. There are about 184 matched pairs of PRO-CTCAE and CTCAE evaluations. Adherence was high. It was around 88 to 99%. These were done on paper with patients in clinic, which is probably one of the reasons for the high adherence level. We found that both amongst patients as well as clinicians, the most common AEs were fatigue, rash, and diarrhea. In general, I would say that the clinicians tended to assess the immune-related adverse events as sort of lower grade and less frequent. The level of agreement in general was low to moderate, which is a pretty consistent finding across studies looking at either chemotherapy or targeted therapies. This is a similar finding, but it shouldn't be interpreted that patients and physicians disagree, because I think in the end, the PRO-CTCAE is really meant to be complementary. It's not meant to be replacing the CTCAE. And then the questions themselves do differ. So for example, on fatigue for CTCAE as clinicians, when we grade, it's focused on its impact on ADLs. And when patients are asked about fatigue using the PRO-CTCAE, it looks at different components. It looks at severity. It also looks at interference with daily activity. So the questions themselves are different in that sense. I think, one thing that was sort of interesting to look at in the results, and we did this visually with figures, is just that the heterogeneity or the distribution of results was broader amongst patients. So when you ask clinicians about fatigue, it's mostly grade 0 and grade 1. And when you ask patients about sort of the same thing, you'll see a range of scores from sort of 0 to 4. So I feel like we do learn a lot hearing directly from patients about what they're experiencing.
Yeah, thank you. This is very interesting. Lastly, we would be grateful to hear your thoughts, on the role of PRO-CTCAE in managing immune-related toxicities.
Yeah, so I would say at this time, the role of PRO-CTCAE in managing immune-related adverse events is still investigational, in the sense that we don't really know what particular score correlates with, for example, the need for steroids. What we have learned from previous studies is certainly when the PRO-CTCAE itself is the intervention, that it's really essential that clinicians are getting the feedback of those results in real time from patients, because it certainly enhances communication. So I guess I would say at this time, still investigational, but I think it's a really wonderful tool. And ultimately, it'll take larger trials to assess its role in management in practice. But in the meantime, I think it's really valuable to build into both our early and late stage, clinical trials.
Thank you. And thank you very much, Dr. Autio. It was delightful to discuss the findings from your paper. I would encourage everyone to explore the paper in detail, which is available online at JIPO. Thank you very much for your time.
Thank you.